and welcome to yet another episode of Tablet. Today we have with us Dr. Mathew Dominic, who is an ENT specialist. Let us welcome him to the program. Welcome, Doctor.
Thank you.
Could you tell us more about yourself?
As I said, my name is Dr. Mathew Dominic. I'm working as an ENT head and neck and cochlear implant surgeon at Medical Trust Hospital in Ernakulam.
So, Doctor, we have got some questions from the viewers, mainly from UAE. So, we'll move on to the questions.
Okay.
The first mail is from Abu Bakr from Sharjah. Doctor, what does ENT stands for and why is it brought under one specialization?
ENT stands for ear, nose and throat. Throughout my career, it's the first time somebody has asked me, why is it brought under this one? These are three organs that are in the face, in the skull. Probably the only other organ that is not there is the eye. Eye is a specialty by itself. The ear, nose and throat actually connected together. The nose leads to the throat. So there is a connection between the two. And there is a tube from the back of the nose that goes to the ear. So any infection that say starts in the nose is likely to affect both the ear and the throat. And probably that is the reason why it's classed together under one specialty.
The other question that he has asked is, why do earwax accumulate too much in the ear for some people, but for some people it found to be less? And do overusage of earphone can increase earwax?
Okay, human beings are all different. Okay, so it is not the same for every person. Every person is not built the same way. If you take the amount of sweating, it is different. Not every person sweats to the same extent. Depends upon your genetic predisposition, how your heredity, your build, the food that you take, all those things affect your bodily functions. So amount of wax that is produced also varies from person to person. Wax, the amount of production of wax also varies daily. It depends even with the emotions. You can have an increase in the wax production by intense emotions. So all those factors come into play in the production of wax. So you would have somebody who has less wax and somebody who can have more wax. The same way as sweating can vary from person to person. Now, wax is something, ear is a self-cleansing organ. You don't actually have to use buds or anything to take the wax out. The wax that is built out inside, the wax that is accumulating inside the ear comes out on its own. Anything that is counterproductive, that one, if we put anything into the ear, that tends to slow or retard the migration of wax. So if you use earplugs into the ear, that is actually retarding it. So earplugs are a cause for accumulation of wax.
Okay. The last question that he has asked is, what's the best way of cleaning the ears?
Best way of cleaning the ears is leave it to God. It is something that is structured in such a way that the skin migrates out. So it's a cul-de-sac, it's a small tube with the eardrum at one end. So anything that is produced inside the ear tends to come out on its own. Okay. So best thing is to leave it alone. After you have a shower or a bath, just clean the outside of the ear with a dry cotton towel. That's the only thing that you need to do. You don't actually have to use an earbud. In fact, the earbud tends to push the wax inside. Okay. Leave it alone. After a shower, just clean the outside with a dry towel. Okay. That's how you clean your ear.
Moving on to the next mail. And the next mail is from Sarah, Dubai. What are common causes of nasal obstruction and what is sinusitis?
There are umpteen number of causes for nasal obstruction, from very common cold to more sinister things like cancers and all those things. But I would say the most common thing that you will find is just a cold. You get a cold, there's an increase in the lining of the nose, the thickening of the lining of the nose, there is swelling of the lining of the nose causing a nasal block. You would find in all common colds. Next one would be allergy. There's an increase in the allergy in the population. So children wake up in the morning with a little bit of sneezing and nasal block. So this would be the most common causes of nasal block. Then you have structures inside the nose. You have the septum, which is the partition between the two nostrils. It's a very common finding to find the septum to be deviated to one side. It's called the deviation of the nasal septum. So if the septum, which is the partition between the two nostrils, is turned to one side, it's bent to one side, it can cause nasal block. Then you have, like she said, sinusitis. Sinusitis is a infection in the sinuses. So that again causes swelling and edema of the lining of the nose, causing nasal block. So allergy and sinusitis can cause polyps, that is just masses inside the nose. It can occur on one side, it can occur on both sides. That also can cause nasal block. And then of course sinister things like cancers inside the nose. In children, one of the most common causes of nasal block is adenoids. Adenoids are like tonsils, which is behind the nose. So that enlarges in children, causing nasal block. Your second question Sarah has asked is about sinusitis. Sinus are hollow regions inside the skull, around the face. Probably that is to reduce the weight of the skull. And you have a pair of sinus above the eyes, it's called the frontal sinus. Pair below the eyes called the maxillary sinus. In between the eyes called ethmoidal sinus. There is one behind called the sphenoid sinuses. They are all hollow areas inside the skull. And they are connected to the nose with very small channels. These sinuses have a lining of mucous membrane and they secrete mucus. And that helps to sort of lubricate the nose and the part of the throat. And now what happens if you have sinusitis? Sinusitis is a swelling of the lining of the sinuses, and that causes blockage of the small channels that connect the sinus to the nose. So whenever there is a collection of secretions in the sinuses, they get infected. So this blockage of the channels leading to the nose, inflammation, and later on infection is called sinusitis.
Okay. And she has asked, what causes sinusitis and does this have any relationship with nose?
Yeah, anything inside the nose. See, you have the sinuses, like I said, and you have these narrow channels which connect the sinus to the nose. So most of the things is problems inside the nose which cause sinusitis. Just a common cold, nasal allergy, you have anything kept inside the nose like children keeping foreign bodies inside the nose, polyps. All those things can cause outlet blockage, the blockage or the sinus passages leading to the nose, leading on to sinusitis.
Okay. How does this occur? Like, what are the symptoms of
Symptoms, okay. The first thing that you have is a sensation of congestion inside the nose, a feeling of block inside the nose. And then later on, as the infection sets in, you can get a heaviness of the head. Patient complain of heaviness, I feel the head feels heavy when I wake up. Then as the infection progresses, the bacteria starts producing pus, you get slight fever, and then the classical headache of the sinusitis. And then you have discharge from the nose, which is purulent to start with. So you have blockage of the nose, nasal congestion, heaviness of the head, followed by headache and fever.
Okay, will this occur again, like when it's after it's cured?
It's like asking, can you get a fever? You can. Sinusitis is something, it is not a serious disease. Okay, so a person gets a sinusitis, it is cured by whatever measures, antibiotics and all those things. But the thing that caused the first infection can happen again. It's like a fever coming, a viral fever coming again and again. Sinusitis, yes, it can come again.
So moving on to the next question, and the next mail is from Samir, Dubai. What is tonsillitis and how is the cause of tonsillitis?
Tonsils are two organs which you have in the back of the throat. Okay, so you have the foot passage and the side you have the tonsil. Okay, so it tends to collect germs. It is something like a filter, so it tends to collect germs. So when you have an overload of germs, you can get tonsillitis. Tonsillitis is an inflammation of the tonsils. So they enlarge, they cause pain and fever.
Okay. How can it be treated, and when do doctors say that tonsillitis needs to be removed?
Tonsillitis is an inflammation of the tonsil, like I said, causing pain, fever, difficulty in swallowing. So initially what we do is, initial tonsillitis usually it's a viral. So a little bit of gargle and some painkillers is what I generally would give. If it is kept for some time, there is a bacterial infection, at which point you need antibiotics. So initially with a little bit of antibiotics, a little bit of rest, gargle, the thing tends to settle down. A person who has got a tonsillitis can again get recurrences. If a child gets about 4 to 6 episodes of tonsillitis, severe enough to keep him off school, requiring antibiotics, and if it goes on for 2 to 3 years, that is the time we would recommend a tonsillectomy.
Okay. If someone complains about difficulty in swallowing, what are all the conditions one can suspect?
When you say difficulty in swallowing, there are 2 things that is involved. Like if you have a patient with a tonsillitis, it is a pain that causes difficulty in swallowing. So that is pain causing difficulty in swallowing. Then you have obstruction, something that is blocking it. Okay. So when you say difficulty in swallowing, these are 2 things that comes to mind. Difficulty in swallowing due to pain, difficulty in swallowing due to obstruction. Difficulty in swallowing due to pain can come from anything, any infection inside the mouth. You can get a very small aphthous ulcer, which is very superficial small ulcers that children and adults tend to get very often. You get a tonsillitis that can cause difficulty in swallowing because of pain. And any of the complications of tonsillitis can cause difficulty in swallowing. These are usually infective conditions and easily treated with painkillers. You can give analgesics, painkillers, gargles and antibiotics. So with that usually it tends to settle down. Now difficulty in swallowing because of obstruction, that is because there is something growing there. Tonsillitis as such, even if it is big tonsil, does not actually block the sound. The causes would be even lower down in your food passage. Any stricture, any constriction in your food passage can cause that. Any growth that is inside the food passage or something outside that is pressing it. You can have a big thyroid swelling causing obstruction. You can have lymph nodes that are enlarged inside the neck causing that problem. You can also have sinister things like cancers growing inside the food passage causing blockage.
Okay. Next mail is similar to the previous mail and it's from Mithun Korfakan. At what point would my child benefit from a tonsillectomy and adenodectomy?
The same thing that we answered before. A child would benefit if the child, a few things that can the tonsillitis and adenodectomy can produce. Okay? Adenoids are actually at the back of the nose. So that is enlarged, that produces problem in breathing. The child keeps the mouth open, has difficulty in sleeping at night, stops breathing at night. So those things would be an indication about taking the adenoids out. Now you say about tonsillectomy and adenodectomy. Ideally they should be treated as 2 separate diseases. Previous this one was to take the tonsil and the adenoids together. It is called the adenotonsillectomy. So tonsillectomy and adenodectomy should be treated as 2 different operations. Tonsillitis and adenoids has to be treated as 2 separate diseases. So adenoids is something that is seen mostly in children. So for them, if there is bad nasal obstruction causing snoring, difficulty in sleeping. Another indication for adenodectomy would be ear infections. There is a small tube called eustachian tube from the ear that goes to the back of the nose, and that is where the adenoids are. So if you have large adenoids or adenoids which are not large but getting recurrently infected, those can cause problems in the eustachian tube, causing ear complaints, otitis media, which is recurrent ear infections or decrease in hearing. So that also would be an indication for adenodectomy. Tonsillectomy, of course, like we said before, the child gets about 4 to 6 infections per year, severe enough to keep him off school, requiring antibiotics. And if this goes on for 2 to 3 years, that would be an indication for taking the tonsils out.
Okay. And the next mail is from Sumant, Abu Dhabi. Doctor, could you tell me what exactly is labyrinthitis and what are the causes of it?
Labyrinthitis is an inflammation of the inner ear. The ear is concerned both with hearing and with balance. It's a very integral, important part of maintenance of balance. So, labyrinthitis is an inflammation of the labyrinth, and because it serves balance, once you have labyrinthitis, what you get is loss of balance or vertigo. It's a severe problem. You get very intense vertigo. And if you get a labyrinthitis, you probably incapacitate for about 2 to 3 weeks. Severe vertigo, you have vomiting, and it usually follows viral infections or infections inside the middle ear. Any pus, or there is a condition called steatoma, which erodes into the labyrinth, causing inflammation there, and that is labyrinthitis.
Yeah. I would like to know the symptoms and also a way to cure this.
I don't know if he had labyrinthitis. Labyrinthitis is actually not a very common disease. It used to be a common disease when he had a lot of ear infections which are not controlled. But in this day and age, most of the labyrinthitis, the ear infections are controlled. So labyrinthitis is not very common. The symptoms are, like I said, very severe vertigo and vomiting. Cure would be depending upon what the cause is, but symptomatic cure would be something that gives sedation to the labyrinth. That is given, and that tablets would improve the condition of the patient. We would generally ask the patient to go to a quiet room, lie down till it settles down, and antibiotics would help to a certain extent. Sometimes you would require a surgery for that one.
Should I be worried about my bleeding ears, and why do I get earache? Can earplugs be harmful?
Bleeding from the ear is a very sinister condition. It's not common like a nosebleed. If you are bleeding from the ear and is not because of you poked into the ear with a Q-tip or a earbud, then it should be seen by an ENT surgeon, because unlike nosebleeds, ear bleeds are not very common. So that has to be seen by a ENT doctor and see what is the cause for the bleed. That has to be looked into. Earplugs, of course, like I said before, tends to put wax back into the ears. So earplugs, unless it is definitely needed, it should not be used.
So moving on to the next question, and the mail is from Sonali Alain. How common is hearing loss, and when do I need hearing aids?
Hearing loss, as you age, everyone is going to get a hearing loss, because all your faculties tend to come down. The eyesight comes down, your taste sensation comes down, your nose, the sensation of smell comes down, your strength comes down. So that with that, the hearing also comes down. So anyone over the age of 60, if you look at the audiogram, which is a test for the hearing, there is a slight decrease in the high frequencies. It's probably not noticed because it's a very subtle thing. And as you age, the hearing loss tends to come down. So the concern is how common it is that it is there in every person over the age of 60. The amount of hearing loss varies. What happens in this kind of hearing loss? I am just talking about hearing loss in old age. The question is how common is the hearing loss? That we have to talk in a very broad way, but I would just talk about hearing loss in the old age. So what happens first is there is something called a high frequency hearing loss, and high frequencies are required for deciphering sound, especially in speech. So first thing that happens is that you start losing out on words. You can hear what a person is speaking, but words become unclear. It is not that clear, and that progresses, especially when there is background noise or somebody is speaking from somewhere else, from say from another room. Common scenario is a husband and wife, elderly couple. The husband speaks from one room to the wife. The wife hears it, but she is not able to hear exactly what he is saying, not clear about what that one is. And that will progress. So what they will come and tell the doctor is I can hear, but I cannot understand what is being spoken, and that tends to gradually increase. So that is one part. And how common is that? Yes, it is common in every old age, old elderly over the age of 60 will have some amount of hearing loss.
Okay. Will my hearing get worse if I don't get 2 hearing aids now? What should I look for when purchasing a hearing aid?
Hearing aids are something that any person with hearing loss should be using it. But there is always a stigma. All societies throughout history connected hearing loss with low intelligence. Anywhere, if you have a person who is not speaking, but who can't hear, we think of him as dumb, deaf and dumb. Okay, you think of that. So there is always a stigma to a hearing aid. That is why hearing aid is not as commonly used as spectacles. You have a 7-year-old girl going into school with the spectacles, nobody has any complaint. You have a 70-year-old man walking around with a hearing aid, there is a stigma attached to that one. But hearing aids, of course that stigma is actually coming down now. Now hearing aids are quite useful. And would you want 1 hearing aid or 2 hearing aids? You don't see people walking around with monocles anymore. It is always spectacle, it is there. Both, you would correct both your eye, this one. So monocles were there when you're using only one lens, but that has changed. God has given you 2 eyes, so you need both your eyes. So that way God has given 2 ears, so it is useful if you use both hearing aids. That retarding the use of 2 hearing aids, one is of course a social stigma, other one is a cost. But I would say that if you are somebody who needs a hearing, like if you are a 70-year-old man, a farmer, not much of social contact, probably 1 hearing aid that is all that is. If you are a working person or if you are a child going to school, yes, definitely you need both hearing aids.
How is a cochlear implant different from a hearing aid, and what are the components of the cochlear implant? And lastly, how does the cochlear implant work?
Basically, the cochlear implant works like the cochlea. Okay, so it is an integral, important part of the ear. So what does a hearing aid do? Hearing aid actually amplifies the sound and gives to the cochlea, and cochlea understands the sound and passes on to the brain. So function of the cochlea is important. The hearing aid, it increases sound and gives to the cochlea. And what does the cochlear implant do? It takes the function of the cochlea itself. Cochlea is the inner ear, which receives the sound and converts into electrical activities. So that process which the cochlea does is taken by the cochlear implant. Like I said, the basic difference between cochlear implant and this one, if you take the eye eyesight, you need little bit of vision if you want to use the glasses. The glasses you can say similar to the hearing aid. You have some amount of vision, you can use glasses. You have some amount of hearing, you can use a hearing aid. But if you don't have vision, there is no point in using glasses. Okay, you need something else which is not available now. So if you don't have vision, you cannot use anything. That's it. But if you don't have hearing also, you can use a cochlear implant. So that is the basic difference between a hearing aid and a cochlear implant. The heart of the cochlear implant is called a speech processor. I'll talk about the parts and how it works and all these things. What the speech processor does is, when I'm speaking to you, or if I'm speaking to a person with a cochlear implant, it is picked up by a microphone and goes to the speech processor. And speech processor does exactly what the cochlea does. It converts the sound energy into electrical energy which the brain can understand. So the component would be a microphone and a speech processor. And speech processor converts the sound energy into electrical energy which the brain can understand, and that is sent into the cochlea. It goes beyond the cochlea, and there is an internal part for the cochlear implant which is implanted inside that has got electrodes. So the sound from here is converted to electrical energy. Electrical energy goes as radio frequencies and goes into the cochlea, the electrodes inside the cochlea which stimulate the nerves, and this goes as electrical energy to the brain, which the brain interprets as what is being spoken.
Doctor, thanks a lot for being a part of our program.
Thank you very much. Honored to be on your program. Thank you.
So that was Dr. Mathew Dominic with us. Until we meet next time, this is me, Naina, signing off. Take care.